remote over there.
Oh, okay, yeah.
Check 1 2 2 2 2 stream test. Check 1 2 stream test. Stream test. Check 1 2. Check 1 2 2 stream test. Microphone check. Check 1 2 stream test. Good again. Check 1 2 2 2 2. Hey hey. Check 1 2.
Thank you, everybody, very much for listening. Happy Health and Medicine Gala Awards. Thank you to Margie and the team for having me here today. I'm so sorry I can't be with you in person, but hopefully one day soon we will convene. Enjoy the rest of your wondrous evening. My name is Thaddeus Tukes. Until next time.
Okay, everybody, 10-minute warning. So please get your food and a drink, and we'll start the program in about 10 minutes.
evening. So welcome to Health and Medicine Gala. For those of you who are here in person and those of you who are online, welcome. How about a hand for Thaddeus Tukes, who gave us the music to start? You know, Thaddeus performed for us last year for our virtual event, so I have to thank him. He came back and did it in person, so I thought it was even better. So thank you very much. So I'm Claudia Fegan. I'm the Chief Medical Officer for Cook County Health. I am the National Organizer for Physicians for a National Health Program. I'm an immediate past president of Health and Medicine Policy Research Group and currently sit on the board. So that keeps me a little busy. Before we get started, at Health and Medicine, we'd like to recognize and acknowledge that we live and work in the land of the Peoria, the Miami, and the Kickapoo, and the Potawatomi nations. These lands were traditional territory for these native nations prior to their forced removal, and they continue to carry the stories of their struggles for survival and identity. As an organization located in the state of Illinois, we are obligated to hold these histories in our minds today as we talk about our community and belonging. I also want to introduce Margie Schaps, who's our fabulous executive director. Margie, I was counting the years today. Over 30 years we've worked together, and really glad for that. Yeah, I have the gray hair to show it. And Steve, where's Steve? He's all the way back there, who is our current president of Health and Medicine. So I want to thank everyone. It's an honor to be here for this year's Health and Medicine, and I want to honor our award winners and reflect on our work as an organization. I also want to thank this year's sponsors and announce that we have a 40th anniversary video, which is playing inside. So anytime that you're wandering in there to grab a bite to eat, you might throw a glance over there. I'm proud of this organization for its unwavering commitment to public health, response to both COVID pandemic and to the pandemic of racism in this country. I am proud that we addressed the urgent public health concerns with partners, elected officials, government agencies, communities, and individuals who are concerned about these issues as well. My time at Health and Medicine goes back to 1988 when I joined the practice of Quentin Young and Hyde Park Associates in Medicine. And Quentin said that I wasn't doing enough with my abundant leisure time as a new physician. And so the first thing he did was drag me to a P&HP meeting. And then he said, and you have to belong to Health and Medicine. I have no regrets. So we have a working board, which is a unique model of collaboration. And we are one of the nation's leading public health think tanks. I want to tell you just a little bit more about the organization itself. Health and Medicine Policy Research Group was founded by Quentin Young and John McKnight in 1981 to address the factors of poverty, discriminatory public policy, unequal access to health care, and other social determinants that lead to poor health. So I want to send a virtual hello to John McKnight, who is watching us tonight along with many others from home. We appreciate the wisdom that John McKnight gave Quentin and many others at the founding of this organization, and continues to inspire us. We were established as an independent think tank, and we have grown and changed but the premise of building health equity and the values remain the same. Health and medicine is a voice to advocate for the disadvantaged and underserved and highlight these deficiencies to the public and the politicians. And I'm proud of the work that we've done to address inequalities in health and the ways in which we have left a legacy of impact. As Quentin famously said, we're not done until we have everybody in and nobody out. I'm going to shout that out for a minute because I really get energized at that. Just once for Quentin, because we know that's what we have to get with healthcare. So join with me. Everybody in, nobody out. See, don't you feel better already? Each day, he would walk into the office, and this is true. He would walk into the office and say, what have we done today to fight the forces of reaction? And every day, those of us working in health and medicine and those of us on the board are guided by this question. So please feel free to share tweets of tonight's celebration. We are hashtag for tonight at hashtag HMPRG Awards. And don't forget to tag Health and Medicine. We're on Facebook at HMPRG Chicago and Twitter at HMPRG. So I know I'm trying to get with it with the social media. It's so important. I want to thank again for the role that you played in our work. And oh, wait, did I skip a line here? I apologize. I want to thank all of you for the contributions you've made to health and medicine and remind you that it takes a village to do the work that we have done over the last 40 years. So a few other people we'd like to thank, the event professionals and our staff who have been scurrying around here trying to make sure this thing happens. I want to thank our board, our funders, our sponsors, and especially our leader level gala sponsor, the Crown family. Crown family? And all the other generous sponsors for tonight's event. Crown family? Okay. And before we get to our honorees, I'd also like to acknowledge 3 special donors this year who have supported our Chicago area Schweitzer Fellows program. And you're going to hear a lot about that a little later, which the Schweitzer program is celebrating its 25th anniversary this year. So the first is Lon Berkeley for the Leslie Nichols Named Fellowship. Mona Ibrahim for her support of the Schweitzer program through the Tariq F. Ibrahim Named Fellowship. And Bob and Carol Perlman for the Bob and Carol Perlman Named Fellowship. These named fellowships go a long way in helping support this incredibly meaningful program. And I encourage all of you here today to reach out to us for information on setting up your own named fellowship. So far, as the beginning of this evening, we've already raised $119,000 from this event. Not to get greedy, but we'd like to raise an additional $10,000. And so there's so many ways you can give. We have a QR code at your table, or you can go over to the registration table, and we have people who are ready to take your cash, credit card, or check. And those of you who are joining us virtually can go to www.hmprg.org to donate. So I'm going to stop talking for a minute and give Margie a chance to have a little fun up here. So, Margie.
And fun I will have. Okay, thanks, Claudia. Hi, everybody. I can't see lots of you, but I'm so glad you're here. I feel so great. I hope you do too. It's really pretty wonderful to be in person with all of you. Um, and thanks. And a special shout out, as Claudia already did, but a special shout out to John McKnight, who I know is watching, who inspired. Well, the story always went that he inspired Quentin to start Health and Medicine Policy Research Group. We'll never know if that's really true, but that was what Quentin said. So tonight we celebrate 40 years of health and medicine, 25 years of the Chicago Area Schweitzer Fellows Program, and our remarkable award winners. Who knew 40 years ago an experiment to create an organization that built on principles of a working board focused on racial and social justice and independence from large institutions so that our progressive views wouldn't have to be compromised would thrive over the decades. It took courage and a belief that pushing public and private leaders to new boundaries of what is possible could gain traction. And yes, it worked. Yeah. In all of our 40 years, we have never seen a collision of so many threats all at once. A relentless virus, renewed expressions of our endemic racist structures, global warming, yet more attacks on abortion rights, disinformation, burnt out healthcare workers, hospitals stressed beyond their limits, inhumane treatment of immigrants, education interrupted, re-traumatized families and communities, and an over-reliance on policing. I'm sure I missed a few. This is the backdrop all of us wake up to every morning. In the face of it, we summon the commitment to work even harder to fix policy and systems and lift up those who have been silenced, beaten down, deprived of rights, and marginalized. At Health and Medicine, we've stepped up like never before. We've never felt more energized and exhausted. Our staff and board have embraced this moment to adapt, to alter course, to take on issues that weren't on our horizon or on our agenda. I admire all of them. Can I ask board and staff to raise your hands? Our history has prepared us for the unexpected. For 40 years, we've advanced equity and social justice through research, policy development, advocacy, collaboration, public testimony, and more. All of our programmatic work is inextricably linked by the core values of healthcare as a human right, the redistribution of wealth, resources, and power, addressing root causes, and an emphasis on primary care. These are the essential ingredients to improving health and eliminating health inequality. Our strength lies in our independence, listening to broad swaths of interests, learning from one another, debating, being nimble, and challenging ourselves to be creative. Sorry, I can't see. To be creative as we craft solutions. Over these many years, we have earned the reputation of trusted, honest broker. Whether you agree with our worldview or not, we are trusted in the corridors of power and in the communities we work with, for our analyses and always valued for our solutions we develop, not always agreed with, but always valued. Our core values have been challenged. They remain intact. We have engaged with new partners, hired 6 new staff, and brought on 2 new board members in the last year. I have never been more proud of the accomplishments of the staff and board, and most are here tonight. Some are joining us by Zoom. You can see you can identify them by their name tags. And I want to acknowledge the many funders who believe in our work and share our commitment to fighting structural racism and building systems that are sustainable and that support health equity. The pandemic has highlighted the continual undermining of the public health infrastructure in our country, including workforce shortages. When we were asked to develop a collaboration of public health employers to identify barriers to expanding the workforce and then create solutions, we stepped up. And after 20 years of working to develop a path for certification and reimbursement for community health workers, the bill was finally passed this past spring. Can I ask the Can I ask the board and staff who work on our workforce efforts to please raise your hands again? All of our workforce efforts. I'm going to ask for lots of hand raising. We've had public, and by that I also mean remote convenings, reaching hundreds of people to address various pandemic-related issues this last year. Most recently, we completed a 3-part series looking at lessons learned during the pandemic from a global, national, and local perspective. The lessons that we learned from this 3-part series will better help us prepare when the next public health crisis inevitably occurs. Our health equity and health safety net staff and board, please raise your hands. I have to call out Linda Murray's moderation of those 3 panels. If you didn't see them, they're on our website and you have to watch them. They're really incredible. Building on the state's Department on Aging's plan, we've embarked on a very ambitious process to create a statewide aging equity agenda, for which we've hired our very first organizer in 40 years, Sandy Pastore, here somewhere. Help us make this grassroots campaign work by going to the website Illinois Aging Together and sign up in support of this campaign. It's the only way we're going to get this statewide agenda passed, so please go there. We've conducted groundbreaking research to see what we can learn about how COVID differentially impacted older adults depending on the settings where they lived. Can I ask long-term care staff and board, please raise your hands. And Mike Gelder, I want to identify up here. Mike Gelder started our long-term care work it is 20 years ago, Mike, half of our life. So when you were 10, exactly. And it's pretty dark up here. Okay. And we built and helped pass an expansion of our 2007 freestanding birth center legislation, now explicitly supporting expanded reimbursement and development of a birth center on Chicago's South Side. Yeah. Thank you. This time offering hope for reducing maternal and infant mortality among African American women on the South Side. Board and staff working on birth center task force for roughly 35 years. Please raise your hands. And Lon Berkeley, I know you're out there. Lon brought this project to Health and Medicine back in 1983. So hats off to Lon. Fantastic. Okay. All right. Our Illinois Adverse Childhood Experiences Response Collaborative developed a statewide agenda for policy change to address trauma and childhood adversity in Illinois. This year, it'll begin to advance the goals identified. And I'd say we have never seen a moment in time where this is more needed, the addressing of childhood adversity. Board and staff working on the ACEs Collaborative, please raise your hands. And Audrey Stollerman, you can be an honorary member of this wherever you are, because you certainly brought this to us. Our Schweitzer program redeployed this year 6 of our fellows to work with the Youth Vaccine Corps to develop curricula and materials to disseminate truth to young people about the COVID vaccine. The next generation of equity-minded social justice healthcare professionals is emerging as we celebrate our 25th anniversary of the program. Nearly 700 of these Schweitzer Fellows in the Chicago area. Please raise your hand, Schweitzer team, staff, and board. I'm happy to share more details and stories of our work, and trust me, I have dozens, as do all of the other board and staff, but not now. I hope you get in touch with any of us, stop us tonight, or visit our website, call us or email us or text us to learn more about our work. The challenges before us are enormous. The collision of threats has not abated. Because we're small and grassroots and trusted and fearless, I think we're uniquely situated to advocate for change in systems that are too often entrenched. As we at Health and Medicine channel our founder, Quentin, anyway, as we channel his optimism tonight, even when times seem really bleak, with your support, we can't help but make progress. We thrive in a collaborative model. We need all of you. We need our board and our staff. We work really closely together. Our funders are so instrumental to our work. Of course, we couldn't do it without you. And all of you help amplify our impact. I'm so privileged to work side by side with the brilliant and passionate colleagues I have. We're resolute in making a difference in the ability of every person in Illinois to thrive safely. Thank you for supporting our work and linking arms with us in struggle. I think it's back to you, Claudia. Sorry, I was supposed to say that.
Okay, so I gave Margie short shrift, and I've done that before, and I have to apologize. So Margie joined Health and Medicine in 1983, just 2 years after the organization was founded. And I remember doing her evaluation, a few years back, and we said to Margie, we said, Margie, Quentin is not going to be around forever. You have to become the face of Health and Medicine. You're too busy standing in the background, and we need to shove you up to the front. And she took that to heart, and I have to say she has become recognized around the state as a voice for progressive health policy, and I want to thank her for her years of service. Yeah, so now you can sit down. So now let's give away some awards. We have some distinguished awardees tonight, and each of our award winners has had a chance to record their acceptance speech. So we'll be timed in advance. And so Margie, Steve, and I will give a short introduction for each award winner before we view their acceptance speeches. Then I'll ask those who are present to come up and actually receive their awards in person. So for those of you who are not familiar with Health and Medicine awards, each spring, and this is all before COVID because everything has changed, but each spring we invite the public to nominate people in the categories of health, medicine, policy, research, and a group. Unique, right? Okay. So, and an emerging leader. So to honor our 40th anniversary, we decided to do things a little differently this year. And so our board and staff and advisory board nominated and chose the winners in 3 categories: under 40, and those with 40 years of experience, and the Quentin Award to groups that have made a indelible impact on public health in Illinois. And so we call the Quentin Award because Quentin always reminded us that we cannot make significant change without linking arms with others. And so our struggles were the struggles of others, and that we could be much stronger when we work together. So we have our inaugural Quentin David Young Board of Directors Award of Excellence tonight. And as in the past, these award honors the public health champions of our community who transform and improve the lives and the well-being of all, both every day and in times of crisis. So tonight's first under 40 awardee is Keith R. Green. Keith is a native of Chicago with strong community roots and an extensive history as an organizer, an educator, a researcher, and an advocate. And currently an assistant professor in the School of Social Work at Loyola University, his current research focuses on understanding the role of community-based organizations in the antiretroviral-based HIV prevention era, and as well as the rise in methamphetamine use among Black men who have sex with men. Keith was a founding member of the Chicago Black Gay Men's Caucus and also served as the director of the Project Prepare, one of the first studies to explore the integration of evidence-based behavioral intervention with pre-exposure prophylaxis. He also served as the director of federal affairs at the AIDS Foundation of Chicago, where he advocated for the implementation of the National HIV/AIDS Strategy and the Affordable Care Act, with specific focus on increasing access to HIV treatment and prevention services of marginalized populations. So, can we start the video?
Thank you so much to the Health and Medicine Policy Research Group for this very distinguished award. It's truly an honor to be acknowledged for simply doing what I believe that I was born to do, and that's educate and enlighten my community about all things health and wellness by any and all means necessary. Thank you to my friend and former high school classmate, Ms. Sharonda Kimbrough, for the nomination. To my family, both natural and extended, for their unwavering love and support and for instilling community values and love inside of me. To the HIV/AIDS community for the many years of struggle and sacrifice, for never giving up hope, and for teaching me what I needed to know to stay alive and find innovative ways to share that knowledge with others. And last, but most certainly not least, thanks to God for giving me direction and purpose. Thank you all for being here. Have a great night.
Yeah. Do we have this word? That's the best part. Okay, Steve, you get a chance.
I never get up here. Our second under 40 honoree is Elizabeth Salisbury Afshar. Elizabeth is a family medicine physician, addiction medicine specialist, and preventive medicine public health expert who has served in a variety of roles where she has worked to improve the lives of people who use drugs and alcohol, including as the medical director of behavioral health systems in Baltimore, where she developed and oversaw the Baltimore City Overdose Prevention Plan and the Opioid Fatality Review Board. Elizabeth also served as the medical director of behavioral health at the Chicago Department of Public Health, where she developed department strategy to address the opioid crisis here in Chicago. She helped standardize the tracking of opioid-related outcomes and developed collaboratives to increase access to medications for addiction treatment. Elizabeth has also served as the medical director of Heartland Alliance Health. Somewhat sadly, in 2020, she moved to Madison, Wisconsin, where she now works as an associate professor, offering clinical care and participating in a variety of research projects, most of which involve addiction-related services for people involved in the criminal justice system.
I would like to start by saying how honored and humbled I am to be receiving this award tonight from Health and Medicine Policy Research Group, especially considering that HMPRG has held such an important role in my own professional development. I remember my first time stepping foot in the HMPRG office was as a medical student attending my first Physicians for a National Health Program meeting, later becoming a Schweitzer Fellow as a medical student, then serving as an advisor to Schweitzer Fellows, and eventually having the opportunity to serve on the board. Through all of these experiences, I've found health and medicine to just be so instrumental to my own professional development and understanding what it means to be an advocate and understanding what it means to partner with community. I know that often there are trainees at these events, so I just wanted to take a few seconds to talk about my own career trajectory. When I started medical school in 2002, I thought I would end up focusing my career on HIV and AIDS. So when I moved to Baltimore and wanted to practice HIV medicine, was told that they had enough providers to treat HIV, but what they really needed was someone who could treat opioid use disorder. I was simultaneously working with the Baltimore City Health Department and the Maryland State Health Department on public health projects, and was being asked to work on opioid-related overdose activities. And the short story here is that I ended up having a career which has been extremely meaningful, extremely fulfilling, very focused on social justice and racial justice issues that are pervasive in the field of addiction and overdose response. But it's not where I intended to be. And I think one of the main lessons I've learned in my career thus far is that sometimes where we think we're going or where we think our interests lie end up not being what's most needed in the community. And that when we're willing and able to be able to take those opportunities as they come, you can make tremendous impact. And I am hopeful that in the end, my work will make impact on the lives of people who use drugs and their families. Thanks again so much to Health and Medicine for this award.
Elizabeth, I know you're here.
Okay, so now for a commercial break, right? So this is our first fundraising check in the evening. So we've launched a number of fundraising initiatives to strengthen our individual and corporate fundraising programs. And I have to say that this past year has been really difficult and very challenging for organizations, nonprofit organizations around the country, because folks are struggling in many ways. And so donating has not necessarily been something at the forefront. So we have, where's Lon? Because Lon, stand up, because Lon has one of our hats, and you can get one of these cool hats. All right. So we have posters of Quentin marching in Chicago with Martin Luther King, and we have copies of Quentin's memoir in the back for sale. And anyone who's willing to join our monthly donation club at $10 a month will get their choice of taking home one of those hats or a poster or a book. And if you want to donate $20 a month or more, you get two. And if you want to donate $30 a month, you get one of each. So you could go home with all three tonight. So we also have a new option to donate stock. And it's incredibly easy to do with our partnership with Overstock. And it takes just a few minutes or a few turns. You want to turn over a few shares of Uber or Disney, enough cash to support a Schweitzer Fellow, or our long-term care efforts, or our ACES program. Any of our other work, we're not picky. We'll take any support we can get. And if you want to make a one-time gift, I'll remind you again, there's that QR code on your table that you can scan, or the table in the back. We have, like I said, we'll take cash, we'll take checks, credit cards. We're trying to raise another $10,000 tonight. We're just $10,000 away from our goal, and I think we can get there. But quite honestly, we'll take whatever you can give. We appreciate all the support, so we can keep doing our work. And so now I want to it says over 40. We don't mean over 40. We mean people who have 40 years of experience. Okay? Let's be cool about this. So I have the great pleasure of introducing the first of our 6 outstanding individuals who have won the Over 40 award this year. There we go. So our first honoree is Jacqueline Boone. I'm so proud of Jackie. So Jackie has 42 years of experience as a registered nurse. And these past 2 years have been really challenging for nurses around the country. She's dedicated the last 20 years of her career to public service at Cook County Health at the Ruth M. Rothstein Core Center, the largest HIV/AIDS center in the Midwest. 1/3 of all the patients who are HIV positive in the state of Illinois are taken care of at Core Center. She has worked tirelessly with infectious disease teams to coordinate comprehensive quality health care for populations seeking HIV/AIDS and hepatitis C care and sexual health services. But even more important, in the past year, during the COVID-19 pandemic, Jackie coordinated the robust nursing response for all of the Cook County Health ambulatory COVID-19 related services, including testing, antibody infusions, and our mass vaccination centers. Can I say that she was the quiet voice of reason in the midst of chaos, and that she had a way of reassuring everyone that we could get this done? Her work includes ensuring COVID-19 nursing services for detainees at Cook County Jail, where we had to open a boot camp separate from all of the other facilities at the jail to provide care and try to isolate the virus. Please play Jackie's speech.
It has been a privilege to work in public health for multiple decades. The continuous effort to remove obstacles and promote optimal health has been challenging, but accomplishments have been so rewarding. Working for Cook County Health at the Ruth M. Rothstein Core Center, the largest HIV/AIDS center in the Midwest, has been the best part of my 4-decade career. I have been able to participate in the progress of the HIV/AIDS epidemic from unsafe, detrimental conditions with great public health risks to a condition that with compliance and medication adherence can reduce the viral load to non-transmissible levels, protecting the community and increasing the lifespan of those with HIV. The advocate and champions who mobilize to raise awareness, educate the public, and demand equity in treatment and access must be acknowledged for their efforts. Because without them, the treatment of HIV/AIDS will not be as advanced today. The comprehensive services provided by the workforce, while encouraging those impacted to thrive, has been amazing to watch and support. The backing of their accomplishments with the National HIV/AIDS Strategy, focusing on reducing disparities, preventing stigma and discrimination, have led to these positive health outcomes. It takes a country to invest in health improvement efforts. We see this with the COVID-19 pandemic and the country's effort to bring this virus under control. I have worked relentlessly with Cook County Health to coordinate the nursing support to vaccinate approximately 900,000 citizens. This effort has contributed to decreasing acute disease, hospitalization, and death. Like the HIV epidemic, COVID-19 will require intense investment and public health support. Cook County Health leaders, thanks again for the nomination, and the Health Medicine Policy and Research Group for the award. It has been a pleasure to serve, and with the positive outcomes because of the intense work, there has been no regrets.
Thank you.
Oh, Jackie, what a career. Our second over 40 years of experience and work in public health award winner is Representative Robin Gable, who couldn't be with us tonight, but you will hear her in a moment. Robin is a longtime Evanston resident and has represented the people of the 18th Health District since 2010. A little sidebar is that Robin and I went to public health school many years ago in the 70s at the University of Illinois School of Public Health. During her time in the Illinois House of Representatives, she's earned a reputation as an independent, progressive legislative leader, successfully passing over 50 sponsored bills. She serves on the Medicaid Working Group, the Budget Advisory Group, and the Energy Working Group, is the chair of the Great Lakes Legislative Caucus and the Council of State Governments, and was recently appointed Assistant Majority Leader. Her priorities include helping to lead the Illinois House of Representatives on racial equity, ethics reform, affordability and access to quality health care, clean energy, and safety net funding for our most vulnerable residents. She has been recognized by dozens of organizations for her dogged leadership and commitment to progressive solutions. Most recently, Health and Medicine has worked closely with Robin to pass legislation on freestanding birth centers and on community health workers. Let's hear from Robin. Oh, let me also just mention that many of you might know Robin from an earlier life when she was the executive director of EverThrive, the Illinois Maternal and Child Health Coalition, and before she went to the legislature. So let's hear from Robin.
I hope everyone is enjoying the evening, celebrating the good work Health and Medicine Policy Research Group has done over the past 40 years. Can you believe it's been 40 years? It's amazing. I would like to thank Health and Medicine for honoring me for the 40 years that I have worked to improve public health and create more equity and fairness in the world. From my days at the Chicago Women's Health Center to the Illinois Maternal and Child Health Coalition, now EverThrive, and now as a state representative, assistant majority leader, I have always appreciated the partnership with Health and Medicine, particularly with advocating for community health workers and freestanding birth centers. Recently, I have helped to pass laws to expand Medicaid coverage to postpartum persons for 12 months instead of 2 months. Since maternal deaths occur up to 12 months postpartum, health coverage is critical during this period. I've also passed legislation to allow pharmacists to prescribe and dispense oral contraceptives. I've passed laws to change the criteria and allow for new birth centers throughout Illinois with a particular focus on the south side of Chicago. We passed laws to include a path to certification and Medicaid reimbursement for community health workers and home visitors. That we've worked on that for so many years together. We've also passed laws to provide Medicaid coverage for doula services, and we are still working on the legalization of home birth professional midwives. While we have taken action on many issues, there's always more work to be done. I look forward to collaborating with Health and Medicine in the future on our shared mission of health equity and social justice.
Accepting Robin's award on her behalf is Mike Gelder, a former colleague at the state of Illinois and dear friend of Robin's. She's at a Council of State Government seminar on Medicaid for leaders across the country in Washington, D.C. Thanks, Mike. Okay, let's advance the picture. Okay. It's my great pleasure to give the next award to Joy Getzenberg. Joy is the quintessential public health worker and advocate. During her 25 years with the Chicago Department of Public Health, Joy provided leadership in the area of the area's first HIV/AIDS plan, the Chicago Cook County Summit on Ambulatory Care, the Chicago Plan for Public Health System Improvement, and Toward a Healthy Future, a groundbreaking policy agenda based on social determinants of health framework that included an examination of adverse childhood experiences before I knew about it, creating the infrastructure with Chicago Department of Public Health that enabled Chicago to become a local, state, and national player in the health policy arena. Joy produced federal and state legislative agendas, numerous health policy position papers, and detailed impact analyses. Joy co-founded the Northern Illinois Public Health Consortium, a group of local health departments that work to build constituencies and influence public health policy and legislation. Since joining the faculty of UIC School of Public Health in 2011, Joy has brought her extensive policy and planning experience to both the graduate and undergraduate programs at UIC. She is indeed a leader and role model for emerging public health workers. Let's hear from Joy.
Thank you to Health and Medicine for honoring my 40+ years of service to Chicago Public Health. We have worked side by side throughout my career. I participated in one of the first work groups that Health and Medicine ever convened, chaired by Health and Medicine co-founder John McKnight on Medicaid reform, and have continued my association, most recently on a project examining funding of local health departments. And congrats to the other award recipients, two of whom I've known for most of my career. One of my most rewarding projects at Northwestern Memorial Hospital was working to create what is now the Near North Health Service Corporation, of which Bernice Mills Thomas has been its longtime leader. And while working at Chicago Department of Public Health, I was there alongside Robin Gable as a member of the MCH coalition she founded and led, the predecessor to EverThrive. Looking back at my career, I have identified two salient features. One, I am proud to be a public servant. To be accountable to the people and not to a board of directors or stockholders has brought to my work an even greater sense of responsibility and urgency. And second, as a trained social worker, I learned very early on of the inextricable link between health and what are now called the social determinants of health. While it has taken a very long time, we are finally beginning to see health and medical care institutions and professionals understanding, and more importantly, addressing these determinants. Finally, thank you again for this recognition of my efforts and accomplishments.
Joy, please join. It's fun to give out awards. It feels good. You all deserve them. Stick around. Our fourth, over 40 years of commitment to public health award winner is Dr. Jorge Girati, a wonderful human being who I've gotten to know in the last several years. During his 37-year career at the University of Illinois College of Medicine, Jorge worked with a wide range of initiatives, primarily focusing on increasing the diversity of the physician workforce. Jorge founded the Hispanic Center of Excellence in 1991 and served as its director until his retirement in May of 2019. The center aims to promote science and medical careers for Latinx youth, expose students to biomedical and clinical research, and increase the representation of Latinx faculty in the medical school. Through the Hispanic Center of Excellence, the UIC College of Medicine became the #1 producer in the country of Latinx physicians. Jorge also served as an associate dean for admissions and special curricular programs for the College of Medicine, where he developed, launched, and directed the urban medicine program in 2005. He is indeed a visionary leader, and I'm so pleased to give him this award. Let's hear from Dr. Girati.
Thank you so much for this award. I sincerely appreciate your recognition of my life's work. I am humbled by the accomplishments of the group sharing these awards tonight. I must say at the outset that whatever I achieved in my professional journey would not have been possible without the support of my wife, Mariela, and my children, Jorge Luis, Marjorie, and Daniela. Many of us who believe in striving towards social justice must balance the needs of those that we serve with the needs of our own family. I also want to express my appreciation to the students with whom I worked over the past 41 years. So many of them endured racism, sexism, ageism, and other forms of discrimination, and still succeeded in their goal of becoming physicians and other health professionals. I feel fortunate to have supported their goals, and it is very fulfilling to see them serve disenfranchised communities around our country. I would be remiss if I didn't acknowledge my colleagues at the University of Illinois College of Medicine, both those that supported my vision and those that did not. I learned a lot from each one of them. They helped me realize that it truly takes a village to achieve a just society. I am particularly indebted to my friends and colleagues at the Hispanic Center of Excellence. Finally, congratulations to the Health and Medicine Policy Research Group on this momentous occasion in your history. Your work in holding leaders accountable to the communities that they lead is as important today as it was 40 years ago. Undoubtedly, your efforts will be even more critical in the next 40 years. Thank you again.
I remember when you came to U of I. All right, another commercial break. I just want to remind you that we have these fabulous gifts and that we take cash or check or credit cards. You know, I'm going to tell you something. Quentin told me that you can't be serious about the cause unless you're willing to ask for money. He said, the right knows how to do it. And so we have to always remind folks that, or you want to take home a poster, or, you know, if you want to donate stock. I mean, we're here. We're happy to take all donations in kind to support the organization. And before I get in any more trouble, I'm going to let Steve come up and give the next award.
I believe that is what is known in the business as good trouble, Claudia. This is always, I'm going off script, so I'm going to be in trouble. A really enjoyable and inspiring night for us at Health and Medicine. And this year in particular for me, when I think about our 2 under 40 recipients, and I look at the people who have gotten honored for 40 plus years, it tells a story. It's a continuity of advocacy, and it's really inspiring to know the advocacy for health justice is going to continue into the future. So I hope everybody else is feeling that same spirit and will be moved, as Claudia said, to support the movement for health equity. It is now my great pleasure to introduce someone who Joy already introduced, our next 40 Years of Service Award winner, Bernice Mills-Thomas. Bernice has served as the CEO of Near North Health Services Corporation since 1991. Under her leadership, Near North Health Services has grown from 1 health center to 9 comprehensive full-service centers and 2 supplementary WIC, Women's, Infants, and Children's sites that provide services and education to 45,000 medically underserved and low-income men, women, and children throughout the Chicago metropolitan area. We're going to let the train go by. Could be a long train. With a career in healthcare that spans more than 40 years, Ms. Thomas is dedicated to improving the health and well-being of individuals and families who reside in low-income, medically underserved communities. She's been honored by public and private entities for her devotion and unparalleled commitment to empowering communities and for her ability to develop and implement human service health programs that improve the quality of life for many of Chicago's citizens in oppressed and under-resourced communities. Please join me in saluting Bernice, and let's hear from her herself.
I am extremely honored to be receiving such an important award like the 40 Years of Service Award from the Health and Medicine Policy Research Group. This is a group that I have known and followed over the years, one who has remained true to its values and its belief that in this world, every person should have access to affordable quality health care, and you never wavered. I, like you, have fought and will continue to do so for individuals who are met with unfair and avoidable differences in health status. Again, I am grateful for the recognition that I have received because I'm sure that every other nominee was or is capable of winning it, if not more so. Congratulations to other recipients, Margie, and the board members who have worked to advance your core values and mission of health equity. I wish you continued success. Thank you very much for this honor.
Yeah, that's great. I met Bernice at the beginning of my career. It's great to see her receive recognition. Everybody have a smartphone? People have smartphones? Take out your smartphone. No, I want you to scan that QR code and make a donation to Health and Medicine. Okay, so now for our final over 40 award winner, Dr. Peter Orris. So Peter is a, I could tell a story about Peter. I'm going to try and restrain myself, But Peter is a professor of environmental and occupational health sciences at UIC School of Public Health and the chief of occupational and environmental medicine at UIC. After graduating from Chicago Medical School, Peter completed residencies in internal and occupational medicine at Cook County, where he practiced and taught for over 35 years, previously serving on the faculties of Northwestern and Rush University. His research and teaching have focused on international healthcare systems, including the Cuban healthcare system, as well as eliminating racial and economic discrimination promoted by the U.S. for-profit healthcare system. And he is also focused on unionization. I remember him handing out those cards to unionize the Doxit County, as well as occupational and community effects of toxic chemicals and sustainable healthcare and climate change. Dr. Orris has served as an advisor to many government agencies, labor unions, and advocacy groups, including the World Health Organization and the International Labor Organization. He's one of the proud founders of the Chicago Area Committee for Occupational Safety and Health and the Physicians for a National Health Program, and currently serves as the co-chair of the Environmental Working Group of the World Federation of Public Health Associations and the World Medical Association Environmental Caucus. Okay, I'm going to tell the story. So, Peter knew my people have different political affiliations, we'll say. And as a result of Peter's affiliation, he actually knew my mother before he knew me. And I remember that my mother was going to have surgery, and I was chatting with her before she was going to have surgery after they had medicated her. And so I asked her about how she knew Peter. And she looked around and she said, I can't talk about that here. There might be people listening. And this was not about some illicit affair. This was about politics. We were quite clear about that. But Let's hear his acceptance speech.
My name is Peter Orris, and I wanted to thank the Health and Medicine Policy Research Group for this recognition. I'm both flattered and honored to receive a 40 Years of Service Award from the Health and Medicine Group. To receive such an award from a group whose mission and accomplishments in promoting social justice and challenging inequalities in health and healthcare is welcome affirmation that my activities have contributed to this effort as well. Health and Medicine's reports, research, educational efforts, support for young healthcare activists, and an unceasing willingness to reach out and create networks and coalitions to secure social change and the eradication of racism in our area is unparalleled. It is unfortunately as true for this century as it was when W.E.B. Du Bois wrote in 1903 that, quote, the problem of the 20th century is the problem of the color line, the relationship of the darker to the lighter races of men in Asia and Africa, in America and the islands of the sea, unquote. Racism is both human civilization's main obstacle to advancement, and when understood, it's its prime opportunity for a more just world. When humans in whatever setting understand that their future is bound up in the equality of all their fellow humans, progress is made in all spheres. When this is forgotten, the past swallows us. This is an exciting time for our country with new understandings of this truth, but fraught with the most serious dangers. I look forward to working with you all for the next 40 years in the most exhilarating human movement for humankind. Thank you.
The crowd applause for Peter, right? All right, I think each of the awardees so far should be awarded for being able to say the name of a group that couldn't limit their title to only 5 words, you know. But next we're going to do the group awards. Okay.
All right. Community organizers often say that the power behind social change comes from 2 forces: organized money and organized people. Claudia's got the organized money part, so we're not going to belabor that for the moment, although there is a QR code on your table in case you were in the other room. But our 2 group award winners are people doing the work of organizing people in communities for the power for social change. So I'm honored to introduce the first of our award winners, Illinois Unidos, as one of our group award winners. Illinois Unidos was co-founded by Xavier Nogueras and Cesar Rolón, and is a consortium of over 150 Latino elected and appointed officials, health professionals, representatives of community-based organizations, business professionals, and other stakeholders. This group was formed just this past year in April 2020. The initiative has worked to present one united voice in stopping the devastating impact of COVID-19 in Latino communities throughout the state. Illinois Unidos raised public awareness to the inequities of COVID-19 testing, contact tracing, and subsequently vaccine distribution, as well as identifying the devastating economic impact in Latino communities. Illinois Unidos has developed culturally and linguistically appropriate public health approaches that target youth, children, essential workers, migrants, and older adults. Using a community engagement and participatory empowerment approach, the coalition has followed the social justice framework that is advocated by Health and Medicine, and consistent with our own mission and values. Over the past 18 months, they have used every health communication platform available: town halls, mainstream media, community-based organizations, professional journals, and community health centers to get the word out about testing and vaccinations to Illinois' robust Latino community. Their successful advocacy has led to over $600,000 in funding from private foundations to conduct community outreach, education, and marketing of the urgently needed, culturally and linguistic appropriate key public health messages. Let's hear from the group.
Hello, my name is Cesar Rowland, co-founder of Illinois Eagles. We'd like to thank the Health and Medicine Policy Research Group for this incredible recognition. Illinois Eagles is a network of more than 200 volunteers addressing the immediate and long-term impact of COVID-19 on the Latinx residents. At Illinois Eagles, our work is to ensure that pandemic's impact on Latinx population is understood widely and addressed equitably. Utilizing our contacts with elected officials, healthcare professionals, and nonprofits, Illinois Eagles has recognized nationally and now being duplicated in other states. Illinois Eagles has assisted government officials and philanthropic organizations understand COVID-19 at a neighborhood level. That work includes advocating for the less resilience on COVID-19 hospitalizations in the Latinx communities as an indicator of our pandemic severity. At Illinois Eagles, we prioritize local residents' roles and community knowledge by exposing them to different viewpoints about science. As we continue to grow, our hopes to expand Illinois Eagles and convert into a resource that can address all community health issues amongst all Latinx residences. Thank you once again for this recognition.
My turn to screw. Right. I had forgotten that I'm doing General Iron too, which surprises me. Our second group award goes to the Stop General Iron campaign. Stop General Iron is a coalition of residents in Southeast Chicago who worked to prevent General Iron, a proven polluter that spewed toxic auto fluff, generated nauseous odors, created loud noises, and endangered neighbors for years from moving into their neighborhood. They're led by nurses, students, teachers, faith leaders, and everyday citizens who believe they should not have to sacrifice their health for jobs and a shot at middle-class life. Stop General Iron partnered with other environmental justice organizations, nonprofits, and neighborhood groups to speak with one voice to stop the relocation of General Iron into their residential community. Both Ronnie Nicole Fasson, principal and CEO at St. Francis de Sales High School, and Olga Batista, executive director of the Southeast Environmental Task Force, were kind enough to share a few words about their involvement in this incredible campaign.
As a resident and proud principal of St. Francis de Sales High School, I would sincerely like to thank the Health and Medicine Policy Research Group for this beautiful award. I accept it on behalf of the residents of the Southeast Side and South Chicago communities that are often unheard but relentlessly fight for its future. A community that values family, a community that has endured despite the lack of resources or opportunities, a community full of grit, my community. Our story is one of survival. We are tired of surviving and we are ready to thrive. We are fighting for the future of our kiddos, our families, and reclaiming our little piece of the world and adamantly saying, you cannot come into our home and not care for her. There was an assumption that was wrongly made. The assumption was that we, mostly Black and brown faces, did not understand the environmental impact of a company like General Iron. But we did. We had seen it before with the steel mills and what it meant to the health of our community and our green spaces. The assumption was wrongly made that we did not care. We do, and because of that, we marched. We staged a hunger strike. We elegantly spoke at town hall meetings. We petitioned and worked with our local government. We appealed to the press. But our fight isn't over, and we are so thankful that you value our story enough and thought it was worth retelling. Many thanks, and have a wonderful evening.
Hi, everyone. My name is Olga Bautista, and I'm the Executive Director of the Southeast Environmental Task Force. I'm also a lifelong resident of the Southeast Side, and I have dedicated most of my life to fighting for the health and the well-being of people in my community. I am incredibly honored to be accepting this award on behalf of the Stop General Iron campaign. For decades, the industrial corridor near the Calumet River has created conditions that have negatively impacted the health of our residents, as well as the vitality and the beautiful natural spaces that surround us. I think it's fair to say that due to a number of well-documented struggles we have had to directly take on across all of our nearby neighborhoods against polluting industries such as General Iron, the large metal shredding facility that was proposed to be relocated to the southeast side, which took a hunger strike, among other historic actions, to put those plans on hold, as well as the piles of harmful pet coke that for years towered over us, that many people outside of our community only see the area around the Calumet River as a sacrificial zone for industry to dump on. They don't see the incredible natural areas that we are immensely lucky to have in our backyards, nor do they see the people and the culture and the institutions that work hard every day to make sure that we have a healthy neighborhood to live in. Residents of the Southeast Side have had to bear the brunt of pollution for far too long. And as a result, we have some of the highest rates of respiratory disease and other life-threatening issues such as cardiac disease and cancer. I myself developed asthma as an adult, and I worry every day about the air quality that my children live in, especially as the data has shown that the 10th ward has been one of the hardest hit by the COVID pandemic. Putting an emphasis on the prioritizing public health when it comes to land use, zoning, and permitting is key. This is one way in which we begin a plan of improving the health outcomes of the residents of the surrounding area. Repairing harm that the industrial activity has done to the nature around us could be the first step in truly prioritizing the health of everyone that lives and works in this community. Thank you so much to our partners at Health and Medicine for all of their support in this campaign, which really took us to the next level. And thank you so much for recognizing our hard work in the Stop General Iron campaign.
That was a relentless and brilliant campaign on behalf of the Stop General Iron. And I'm pleased that Health and Medicine partnered with you. Wesley Eplin, Linda Murray, others were so happy to be your partners in this important work. It's okay. I'm pleased to present our final award, and you're probably pleased it's the final award. It's our inaugural Quentin D. Young Board of Directors Award of Excellence, presented posthumously to a longtime board member, Ben Squires, who we lost last year. When he landed his first job in public health, Ben Squires found his life's work. Working for more than 20 years at the Illinois Department of Public Health on various initiatives, he had a particular passion for leading infant mortality reduction programs in Chicago and for mentoring young people. His guidance, support of young people beginning their careers, and devotion to public health equity continued to live on through his legacy. As a board member at Health and Medicine for 25 years, Ben continued to make contributions to public health in Illinois well into his 80s, maybe his early 90s. We are thrilled to have his daughter Sarah with us tonight and to have both of his daughters, Amy and Sarah, provide a few words about Ben's legacy and what this award means. We also thank Sarah and Amy for their generosity in helping to establish the Ben Squires Equity Internship at Health and Medicine, inspired by their father's commitment to help young people. The Ben Squires Equity Internship will support 3 interns over the year at Health and Medicine, one each trimester of the year. We're excited to announce Rachel Donaldson as our first Ben Squires Equity Intern. Rachel's here with us tonight. She earned her Bachelor's of Arts in Biology from Texas Christian University and her Master of Science in Community Engaged Medicine at Furman University. She will be entering the South Carolina School of Medicine in the fall of 2022. And at Health and Medicine, Rachel is just beginning to work with us on our Illinois Aging Together campaign and our workforce efforts. Let's hear from Amy and Sarah.
Hi, I'm Amy Squires, Ben Squires' daughter. Nothing made our dad happier than fighting for justice, especially when he could do it alongside Quentin and Margie and the amazing Health and Medicine staff. He would be so touched by this award. He'd downplay his importance, of course, but inside he'd be beaming. I just really want to thank you for recognizing him, his passion, his purpose, and his time with Health and Medicine. Thanks.
I'm Sarah Squires Doyle, and I'm deeply honored to accept this award on behalf of my father, Ben Squires, who passed away earlier this year at the age of 95. My dad served on the Health and Medicine Board of Directors for over 25 years and was always fiercely determined to push the agenda for health advocacy and equitable healthcare rights for all. My dad loved to tell the story that he dabbled in many careers before finding his true calling in public health. He worked for over 20 years on various health initiatives in Chicago and with the State of Illinois Department of Public Health. He was known as the guy with the bow tie, who always wore a smile and had a lot to say. I will never forget one of our early marches through the streets of the Loop, with Quentin leading the charge, my mom and dad by my side, and all of us chanting, "Everybody in, nobody out." As a way to keep his legacy alive and his passion for mentoring young people in his careers, my sister and I are thrilled to announce the Ben Squires Equity Intern Fellowship Program that we will fund with Health and Medicine beginning this fall. On behalf of my entire family, we thank you again for this great recognition of our dad, Ben Squires.
Thank you. It was always a thrill to serve on the board with Ben. He was that quiet dignity in the corner of the room who didn't say much, but as that old commercial would say, when Ben spoke, everybody listened. Okay, so how about a round of applause for all of our award winners tonight? So, one of the best things about tonight was that we got to see each other in person. And I know there's so many people who are grateful. You said, what? We can see each other without a mask? We can see our face? So I want to ask that after I finish, I know I'm the last thing, and we're about done, but ask all of the awardees to come up after this so we can do a photo op. So I want everybody to come up, please. Tell your family you'll be just a minute more, but we want to get some nice photos. And I want to thank all of you for coming out tonight to support health and medicine. And I hope you will support health and medicine. I mean, your presence is important, but your dollars will get us through the coming year. And that's always important. You know, as I said before, Quentin said, you can't be serious about the mission if you're not serious about the money. And so, you know, I started off doing this. I was a little shy about it, but now I'm kind of unabashed. We need cash. So again, there are QR codes on the table. And as I said, we take cash, but we take credit cards, we take checks. And after this, there'll be a glass blowing demonstration inside. So, and you could also watch the 40th anniversary video. There will be an after party with food and beverages for those of you who don't have to go home and go to bed to get up to work tomorrow. We're going to have music by DJ Alvin Black III. And on your way out, the table will accept donations. So I want to thank all of our guests, our volunteers, and the staff who made this evening possible. And remind all of the awardees to come up again. And so I'm just going to do this because it makes me feel better. I hope it makes you feel better. Just one more time for Quentin. How about 3 rounds of everybody in? Right? Ready? Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Thank you very much. Come on up, awardees, and then everybody else, mingle and have a good time. Thank you.
Folks, if anybody wants to, there's a rooftop and you can go up and it's a gorgeous view of downtown. Please avail yourself of it if you'd like to.